I have a bit of a bad news for you.
Mm-hmm.
You are full-blown diabetic.
What?
Yeah, totally. Like not just diabetic, but you are badly controlled. Like
Okay.
these levels would not just need one line of treatment. You would actually need, with this type of level, you would need either, two type of drugs or even triple therapy, because this is like really bad control.
Okay.
We have a test called HbA1c,
Yeah.
and the reference level is 20 to 42,
Mm-hmm.
and you are 69.
Wow.
Anything over 48 is full-blown diabetic, but anything under 53 is what we say, okay, it's in good control.
Okay.
But these levels have now been silently, now we don't know how long, because you didn't know when you took the out. I think it's okay, I think you can do it. Yeah. This is silently making damage in your body, because obviously type 2 diabetes affects every single part of your body.
Okay.
Obviously the heart and your neurological system is the most obviously worrying, because it's eyesight and so on.
Mm-hmm.
Now, I'm expecting that these levels would have already dropped quite dramatically, because you've been on a low carbohydrate, high sugar diet, and low carbohydrate, high protein diet, and you have been exercising, and you have lost substantial amount of weight, because it's actually the visceral fat.
Yes.
It's the waistline that is the biggest, indicator.
Because the glucose are...
Yeah, because it's your visceral fat that's basically wraps around your pancreas and your liver, which is considered an endocrine organ, for its own rights, and that basically is responsible what we call insulin resistant, which is basically the what type 2 diabetes is all about. So your beta cells of the pancreas are producing insulin, but your body is resistant to the action. This is why, like, your level on the day that I took this was 17.3. So if you think about that, it should be under 6 on your fasting condition. So this is basically, you could say, 3 times higher. Now, at these levels, you would expect some symptoms. But the problem is that many people get used to the symptoms, which would be, chronic tiredness, going to the toilet, waking up in the middle of the night to go to the toilet. Then when you get older as a man, you think, okay, maybe it's my prostate, it goes with the age, where it actually could be typical symptoms of type 2 diabetes. You see, many people say, oh, do I have it in my family members are diabetic, or it's genetic. To be honest, we always have to remember in medicine is that the most common cause is most common, and when you have somebody like yourself sitting in front of me who is morbidly obese, like, I'm not going to look at, oh, it's your family who is the cause. The cause sits here. And when you get rid of this, you're basically making the diabetes homeless. For example, when you think now about yourself, how many stones of excess weight do you think you have at the moment?
Oh, well, for my height and age, probably still 8 or 9.
8, 9 stones. So you see what can happen, that only by losing 3 stone or 4 stone, you already reverse this. But if you stopped your weight loss there and you said, okay, I'm actually going to lose 3, only 4 stone, what most probably going to happen then in that case would be that you could be non-diabetic for a few years. But when you get older, that weight, because when you get older, your body can't handle and it becomes more fragile. So what I'm saying is that what I would recommend that you try to push now your weight as down as
that's
you
really
as what is.
No, I've caught it at the right time. I've caught it at the right time.
Yeah, exactly.
You know what I mean? So it's good. That's
so
all.
basically now what's interesting, we redid the bloods. That's your hard copy for you.
Okay, brilliant.
I am not going to give you a prescription of metformin at the moment. First, line of treatment should be metformin. But because you are doing the diet, and according to the International Diabetes Federation guidelines, you should give a patient 6 months to adjust this by lifestyle. Also, I'm going to wait what the hospital is going to say about those blood results. So if they have gone down and I can see that this is acceptable, we don't need to. If it's not, then I have to prescribe you metformin, and we'll see how it goes. But I think you are really a top student at the moment.
I'm trying. I'm trying, yeah.